In this video, we're going to go over how to work up a diabetic eye exam. This is a new patient to the clinic. So again, just open up the patient, a new exam, and just set the settings accordingly. I already have it set up here. Again, for history of present illness, this will be for a diabetic eye exam, non-insulin. And down below here, said last blood sugar. This says not well controlled, so 160. Hemoglobin A1C 7.8. The last time that was acquired was maybe a week ago. Don't forget to check your mental status exam. Let's go ahead and do another chief complaint. So she's also complaining of decreased vision, and this is in now location, in general central vision in the right eye, and then duration of the problems that's been going on for maybe about a month. The quality, maybe just a little blurry. Modifying factors, none. Associated symptoms, I don't see anything there. Severity, mild. All right, so I'm done with that. Next, go specialty meds. This is ocular medications again. So at this time, it's new. The patient's new and she's not on any specialty meds. I can put just none. And next, go to past medical history. Again, we talk about patient is. All right, so we go down. Oh, diabetes. Also hypertension. All right, let's go surgical history. Let's just say appendectomy. Next, we go to systemic medication. Let's do glucophage. Let's do extended release. Also, let's add another medication. Lisinopril. And next, allergy. Let's say a patient's allergic to penicillin. Family history. Let's say non-contributory. Social history. Let's do default. For negative for smoking, alcohol, and substance abuse. Review system. Let's go down. Again, patient is hypertensive, so let's assume that the patient's blood pressure is stable. Now endocrine. So blood sugar is poorly controlled because A1C is pretty high. All right, so once I'm done with this part, I can pretty much go back and check the history is done. Surgical and review system all done. Next, let's do visual acuity. Patient forgot her glasses or lost her glasses, so the vision is 2150 in that right eye without correction, and in the left eye is 2050. So So next, pressure using applanation tonometry. Patient pressure is 18 in the right eye, 17 in the left eye, using fluoresce. So next, dilation. So I'm going to skip that. I think we should change this order. So just go to refraction. So the refraction, patient has no glasses. So we just do dry manifest. We'll do, see here, minus 150 plus 150 at 179. Add 1 1/4. Next, this one. Patient's vision in the distance is maybe just still 20/60 with that. And the right and the left eye, the refraction is similar, plus 150 at 180. And distance vision in this one is around 20/25. If I happen to be wanting to work in a minus sill, I can go over here and just convert. It'll change that cylinder to from a plus to a minus, or I'll just go back to the plus here. So the vision here is 20/60. Let's see, maybe minus 2, and 20/25 plus 1. All right. So next one I'm going to do is I'm going to go ahead, since this is my refraction, manifest refraction, I'm going to do another row here. I'll do manifest dry. What this does, it allows me to change from what my manifest refraction is. So say if I want to change that to maybe 1 1/4 in this eye, and this one I'll just make it a little bit weaker, and then I can use that as spec RX given. And when I check this, and that's mean this is the one the prescription is to be given. What you can also do here, when you scroll down, if you want to dispense the patient and progressive bifocal and any other information, you can have doctor sign it, refraction save, and then you can also print it here. So next, dilation. So OU by technician using tropicamide. If you happen to end up using more than one, you can also select that for both as well. But for now, just tropicamide, 0.5%. So that part is done. So next for the external exam, again, you want to just have defaults. Pull it over. There you go. Defaults push right for both eyes. General pupils. That's fine. So for the external exam, everything is normal. Anterior segment, I'll go ahead and do this as well. Pull over just a normal default. The only thing I'm going to change is the lens here. I'm going to put down maybe 2 plus NS. Say central. So do that 2 plus NS central. And if the cataract happens to be the same on the other eye, you can ditto OS. But if you want to add this to another finding to the other eye, let's try it. You can click plus OS. So you plus the right lens information in the box to this information to the right box to the left eye. Let's get rid of it. But if you did OS, it just copies. So the right eye and the left eye has the same findings. You can also highlight, so which kind of shows you when you do look back, you go, okay, what's going on with this patient to see that. But its highlighting technique is not that great, so we'll just ignore it. I'm going to do is I'm going to click on this plus PL, so it's going to add to our plan. So we don't have to do it again. So nuclear sclerosis here. I would say both eyes, and I'll add it to the item. So again, what this is going to do is under impression and plan, it's added to this area. Next. All right, next, after finishing the anterior segment, gonioscopy, we want to skip that. Now go to the posterior segment. So we can start with just default. Vitreous is clear, optic nerve is normal, blood vessels, just say normal caliber. Let's see, we're going to do something different here. So central, maybe a little macro edema. Severity, I'll say moderate. And then periphery, maybe some scatter. Dot lot hemorrhages. And I'll say both of these are, I'm going to ditto it to OS. I'll do the same thing with the macula, ditto to OS. Yes, I can do this. I guess there's nothing to add. So next, since I know that there's something going on in the back of the eye, I'm going to go ahead and send the patient to diagnostics to get an OCT of the macula. So what I need to do is go back over, go to diagnostic and order OCT macula, both eyes. And then what I'm going to do at this time, go ahead and move the patient at this time in my exam room. I'm going to move the patient into diagnostic, whatever that box is, and to have them work up the patient. So in diagnostics, what they're going to do, they're going to pull up the patient. They're going to open Intello file, and they're going to browse the file. In this case, I have two that I prepared. So this is the OCT in the right eye. So we're going to go here and just put file type. This is OCT. Save. And save. No. And now I have to browse another file. Open. Now that's the left eye. Also OCT. And then save. Alright, so refresh. I'm going to get out of that. After the diagnostic tech uploaded the image or images, it'll appear under here. Ignore this. This is I uploaded previously. But again, you go under images, you'll see all the previous images as well. You can manage by just putting the right eye in this box and the left eye in that box just to view. We'll go back here. The diagnostic technicians will have to also attach the images to the chart, which is here. There's a correction here. Embedding the images to the chart is not necessary. It is only necessary if you want to send the same images to the referring physician. It's not necessary for documentation. So most of the time we'll have two monitors or a monitor that's large enough where the chart will be to the right side, and to the left side you'll have the patient summary where you can go under images and kind of evaluate that, and also can document and look at and also use that to document your findings. After attaching the images to the chart, we need to document our findings. So here we have the OCT macula that has defaults for the findings. You can see here the bright bubbles are the active bubbles. The lighter color, the grayed out bubbles are what we call ghost bubbles, and those are not active until you click on them. So let's look here. So for this one, did we order this test to monitor progression? No. This is our new patient. Let's see here. Evidence of macular edema. Yes. We'll go back to that. No evidence of retinal fluid. We're going to click that. So let's look on this macular edema. So with this macular edema, there is evidence. So we're just going to click on macular edema, and we'll do the fovea thickness in a bit here. And all of this, let's do ditto to the left eye. So the only thing that we have here, that so both eyes have macular edema. So now we're just going to document the fovea thickness. Let's go back to the image and just click on that to enlarge. 484 for the right eye and 17 for the left eye. So 484 and 17 for the left eye. All right, so we're done with documenting our findings. Next, we go to the impression and plan. So we have one for cataract. We need to add more. So to add more, we're going to go down to, since it's a diabetic exam, click on it. So when we have choices to choose from between the white and the orange, pick the orange because it will help with the MIPS measures. So let's go here. We'll go with the patient has type 2 with ocular complications. And then we have to go make sure when you look at this, it said more data is needed. So go to the right side. This is not insulin dependent. So maybe that, not insulin dependent. So next, let's see here. Patient has diabetic macular edema. That's in both eyes. Oh, this is new. And then what's the other one? This was considered severe non-proliferative diabetic retinopathy in both eyes. So new. All right. So what you can do is just you can change the order. You go, okay, if you want this to go up above that, you can move that direction in order of importance. So next what you can do if you want to, you can go here and just go to defaults. So this is kind of like the discussion with the patient. So discuss the importance of sugar control, prevent ocular complications, community, and of course, these are the defaults finding for diabetic. So I'll take that. So next we're going to schedule for follow-up. Patient's gonna follow up with me in, I'll say, 1 year. All right. I'm also gonna have I'm gonna refer the patient to, Dr. McMullen's not on here. So I'm gonna send to a retina specialist, maybe in 1 week or so or less. I'm gonna look for an injection, perhaps evaluate. Let's see here. Exam, exam, establish complete. Also procedure. Hmm. And I'll just add more notes down below. Possible intravitreal injection. Click on that and go back and check this. And 1 year will be established complete. So next, I'm going to send a report. So with the report itself, I'm going to select what kind of type of report, just a report in general. So these are pre-selected stuff that I picked for my letter to the primary care physician. Let me take a look here. I'm not sure the primary care physicians really care much about the posterior exam. So I'm just going to get rid of that. So when I do that, let's make sure to refresh. As you can see now, it's a little more simplified letter to the primary care physician. So at this point, I can sign a letter or I can fax the letter. But when I do fax it, I'm going to sign the letter and I'm also going to sign the chart. So at this time, I'm just going to sign the letter and just continue. I'll click on the side here. So next is the coding. So let's go to the coding. So in the coding here, there's two parts here. So whenever you see the red boxes, that's we're missing something here. So first select the code. So the code itself, the CPT code, this is an exam, a new patient. We're going to do in a comprehensive. Next, select a diagnosis. So with just our main diagnosis will be here. So that's complete. Now, the diagnostics used for the OCT, we need to select the reason for that. So, oh, I'm going to select in that box. And now I'm going to select that. As you can see, there's no longer any red boxes. And then after that, I can just put down coding complete. All right, after you're done with the coding section, you just click on this coding complete. After that, you can sign the chart, save and close. I forgot to add one more thing. So for follow-up here, besides what I mentioned here, refer to the retinal specialist, type of exam, and possible intravitreal injection. I also wanted to add something else. So I go, okay, well, I want to make sure the technician, it's also where I want them to repeat the macula. Remember, don't click on this. Make sure you click on the plus to add on to this list, or else you can replace the whole list there. So that's what I want to do. And for me, I want to say, I want the patient to come in. I want do a visual field, again, to add a visual field. And because of family history, maybe I'll do also pet chemistry.